So we are heading into that time of year. 'Tis the season, right? When respiratory illnesses begin to spread, and federal health officials say not enough of us have gotten our flu shots. Dr. Amin is Chief Medical Officer of the LA Care Health Plan. That's the public agency that provides health insurance for low-income people in Los Angeles County. He joins us now live. Doctor, just how bad are the vaccination rates?
The vaccination rates right now are pretty low. There's been a lot of vaccine hesitancy in our community, and we are battling that by giving the right information to our members and to the community so that they can get vaccinated. The flu is a serious illness, and even though some people can get through it just fine, others, they end up having complications and can even end up in the hospital. And so we're trying to battle that by getting people the flu vaccines that they need.
Yeah, I mean, you talked about vaccine hesitancy. Do you think there's some vaccine fatigue, too, given COVID on top of everything else?
Yeah, it's been quite a last few years that we've been dealing with a lot of these illnesses that have come on, and obviously initially with the COVID pandemic and then leading into the RSV bump that we had shortly after, and now anticipating that we're going to have at least a decent flu season here. So there's some vaccine hesitancy just because of some of the misinformation that's been out there regarding vaccines, but also some of that vaccine fatigue that you're referring to, with people feeling like they're constantly going to the doctor's office to get shots.
Given the low vaccination rates with regard to the flu in particular, because that's what we're talking about, are you worried about the upcoming flu season?
I am, in so much as now as winter comes on, we end up dealing with a number of these viral illnesses that are coming on all at the same time, whether that's the flu, COVID, RSV. All of these viruses are upper respiratory illnesses that can significantly affect people out here in the community. And, getting one of these illnesses is tough, but getting one followed by the other can be devastating. And so at the very least, I think we need to make sure that we're getting our folks vaccinated for these upper respiratory illnesses where we have a vaccine available, like RSV, like the flu, and COVID.
All right, so Thanksgiving is tomorrow. If you haven't gotten your shot, it's already too late for that gathering. But is it still too late to get a flu shot ahead of the picking up of the flu season? I mean, do people still have time?
Yeah, they still have time, certainly. And particularly as people are getting together for the holidays in December, it's a great time to go out and get your flu vaccine. I would also suggest the COVID vaccine. You can get them both together, and at most pharmacies that are close by to your home, you can go out and get both.
And one more question before I let you go. What about those folks who don't have health insurance, or they think they can't afford the copay? What about them?
Those who don't have health insurance, there's still an opportunity out there to sign up, whether that is for Medi-Cal services or even getting onto the exchange during periods of open enrollment. I would highly encourage you to do that. But these vaccines are relatively low cost, again, available through your local pharmacy and at your doctor's office. If you're uninsured, you should certainly look into the services that you're entitled to by way of Medi-Cal.
All right, Dr. Amin, Chief Medical Officer of the LA Care Health Plan. Thank you so much for your time.
Thank you.